So as Belinda said, my name's Emma Bland. I'm the principal investigator on the Smartline project, and I'm very pleased to be here to welcome you to this event. We have some really interesting and exciting things to talk about, and we'd really love to hear your views and your thoughts on how housing and health and our sector is going to develop over the coming years. So we've got some really exciting speakers. So we're going to hear from George Grant this morning and Helen Milner to sort of give some context and vision to our discussions. We have a number of presentations about some of the research that's been going on and opportunities to explore how that can impact policy and practice. And what I hope we'll end up with is by the end of the day that we will all be going away feeling that we've learnt something new, that we've had the opportunity to sort of share our thoughts and opinions, and to some extent that we're feeling challenged and motivated to look to how we can make change and improve the connection or understanding and the health outcomes related to housing. So just a little bit of background to our current understanding. As many know, Michael Marmot produced a report in 2010 that explored in depth the connections between housing and health and made a number of recommendations. He revisited that report in 2020 and sadly was sort of identified that poor housing conditions continue to harm health in England and widen the health inequalities. So clearly still much to do. And why is it important? And I have here a number of statistics that I wanted to share with you. But I think possibly the most poignant thing to think about when we're kind of looking at the connections between housing and health and why positive housing environments are so important is just to think about the 2-year-old child who's sorry, brain just went blank. What a word I'm looking for. Inquest, thank you, that's the word I'm looking for. Whose inquest was held yesterday, where they clearly identified the cause of death as the mould in the home in which he was living with his parents. So in that context and with that sort of very tragic background, we know that poorest communities have 20 years less good life expectancy than those living in more economically positive households. We know that poor housing is costing and making additional demands on the NHS. And we know that 10 million people are digitally excluded and that 1 in 3 of those are in social housing homes. And that digital inclusion is a really important factor in looking at inequality. So just to bring some of the statistics up to date, the English Housing Survey, which is done annually, in 2021 identified that we still have 4 million homes failing to meet the decent home standard, that well-being levels have declined and loneliness has increased. And while that survey was done during the pandemic, and you might feel that the pandemic has a significant influence there, which I'm sure it did, that decline was actually already being identified in the 2019 survey. So what we're seeing is a continuation rather than a blip. And of course, there's still, and this is the English result, so if you add in Wales and Scotland, I'm sure we could sort of round this number up to saying something like 1 million homes are still reporting damp. So the Smartline partnership has been working together since 2017 and before, actually, because we did a lot of work, and Mark is feeling every inch of that journey with us. We did a lot of work on developing and devising Smartline before we were able to start in 2017, and we're very grateful to the European Regional Development Fund, may it rest in peace, and Cornwall Council for their support and funding of the Smartline project. We are exploring within the project the role of digital technologies in monitoring healthy homes and connected communities to support and improve health and well-being of individuals and their families. And rather than me spend time explaining Smartline to you, I think what we'd like to do now is show you a film that was done which has the participants' voice as well as ours to tell you something about the project. Hopefully it goes. Thank you.
The data we've gathered through working with Coastline residents is an incredibly valuable resource. It gives us a unique insight into how people are using their homes, into things like the temperature in their homes, their energy use, their health and well-being, across a fairly long period for this kind of research. And the richness of the data, being able to layer it, helps us to drive down into the detail of what is really influencing this population's health and well-being.
It's the views of the customer that's important before decisions are made. So, whoever's making decisions aren't making it off the top of their head. They're actually having the input and the data from the customers who have taken part in projects like this one.
The project is started by recruiting tenants from Coastline Housing. Coastline Housing are a key partner with us on the project, and we were able to recruit over 300 households to the project, and each of those households very kindly agreed to have environmental sensors installed in their home, and then also took part in a variety of data gathering questionnaires to allow us to put a picture around the data that we were collecting about how their lives were and where their priorities and challenges were.
I think it's been a very good thing because they've involved us, and no matter what it is, I think I've been on every project they've had because, I'm interested to know how things are going with people and how it works for the coastline to start with, because I want them to be able to help every person.
If you can keep a really healthy environment in a home, then that also helps to keep the plasterwork in good condition or the assets in good condition, the kitchen, the bathroom, and it allows us to keep the maintenance levels where they should be. And I think that whole customer support mechanism is so important. We can look at a group of properties on a dashboard and pick out the ones that need attention, the ones that need us to sort of help and provide support. And that might be a fuel voucher, it may be a hardship, it may be signposting to an organisation who checks that they've got the correct benefits in place, or one of our own teams, the income management team, to do some benefit checking and make sure that they are getting what the finances that they should get.
We've conducted a number of research projects around sensing the home, and what consistently comes out is the importance of people in the system. This system helps you identify risk, but it cannot replace kind of human involvement, human communication, and it is very much people plus technology, not technology replacing people.
Having a pandemic in the middle of the project gave us a real opportunity to educate people and teach them how to connect using things like Zoom, emails, so that they could engage in different ways than they were perhaps used to. So part of breaking down barriers around digital technology is something I would say is a really big success of this project.
It's kind of about action research rather than just sort of pure research. It's about applying research methods to real life context and for kind of to hopefully improve housing.
One of the things that has come out of the project is the value of environmental data to helping to support both how housing association services are delivered to their tenants, but also the wider social context about the conditions and challenges that people are facing, particularly when they're on low incomes or are older and are feeling isolated, and the added value that digital technology can bring to people's lives, but I think with also recognising that many households in those categories of lower income face challenging access to digital technologies, and we need to be very aware of that when we are designing services so that we don't unintentionally exclude people and add to the inequalities burden that they already face.
The 5 years that Smartline has run has enabled us to sort of gather so much information, and moving forward that is something we will be using to hopefully make change at sort of policy level with other housing associations.
In Smartline, we've been able to see that there's real need for a holistic approach to addressing the issues of people's health and well-being. Not just the fabric of people's homes that influence their health and well-being. So it's not just whether they've got mold or not, or whether they have particular energy sources or not. It's also about that community aspect. It's about how people feel embedded within a community, how their social networks are and how they can interact with people around them. So it's important that when we address the issues of health and well-being, we really take that holistic approach.